Aloha, and welcome back to the 8th and final episode of Season 2, Talk Story with House Majority. My name is Della Albaladi, and I serve as the House Majority Leader for the 2021 Hawaii State Legislature. First off, today is the day after the last day of the 2021 legislative session. Let me tell you, I can't believe that we're actually here doing this, but I have two very, very special guests who will be joining me later on in the show to discuss highlights of the 2021 session. For our first community segment, I'd like us to visit District 28 with Representative and Vice Speaker John Mizuno. He took us to Kokua Kalihi Valley Comprehensive Family Services Health Center, where we were able to visit with his community and see a mass vaccination center. Let's go.
I'm honored to introduce our guest and a good friend of mine, Merlita Compton of Kokua Kalihi Valley Comprehensive Services. It's a federally qualified healthcare center. They care for over 11,000 people. The senior center cares for over 1,500 people. And Merlita, can you give us a little background about this wonderful senior center in Kalihi Valley?
Aloha, thank you for coming, and I want to welcome you to visit our Kokua Kalihi Valley. The Elder Center is one of the programs that we provide, and like Mr. Mizuno said, we serve over 1,100 seniors. We provide exercise program, caregiver support groups, respite, and of course we have providers that come and see the seniors here, and it's been great. And it's not only that, we provide the vaccination today. As you can see, we have about, I think we're gonna do 150 people today. So it's been very good. It's accessible for the seniors, and it's great. It's in the heart of the community.
Teresa, thank you for doing this interview. We've noticed that you're doing a lot of COVID-19 vaccinations today, and it's not only seniors, but I see that there are younger people also being involved.
Absolutely. The average here, we've been ramping up since we began in January, starting out with like 40 a day. We're now doing about 140 today, 143. We're looking at going up even higher as we get our numbers settled. Mainly about half today are first injection, but at least half of them are second injections, all finishing up. Mostly our kupuna population, we're really focusing on that. But we are having younger individuals come to the clinic for vaccines because the Kalihi Valley population, a lot of multi-generational families. So if there's someone who's vulnerable in the household who needs to have a vaccine and there are other family members there, we're going to take care of them as well. So you'll see all ages. We've vaccinated as young as 17 all the way up to, I think our oldest was 104.
Wow. Thank you so much for your service.
Absolutely. It is my pleasure to help the community. It's my entire life being in service.
Thank you. Thank you very much.
Yep.
So I had a question. I know you're with the University of Hawaii, I believe School of Nursing. So how did you come here to KKV, this Elder Center?
Well, it started out when the pandemic first really started to be a huge issue in Hawaii. There was a partnership between the Department of Health and the University of Hawaii School of Nursing. And they created a contact tracing program because it was realized that there were not enough contact tracers in the state. So they started this program, and I was in one of the first classes. They hit up a lot of specifically clinicians, physicians, social workers, nurses, nurse practitioners to go through the program because it was a compressed one. And so I began working for the Department of Health. And then it was the next evolution was coming into KKV because this was a very large area of high positivity. And so the vision was that KKV would begin an internal contact tracing program because they have people who work on staff who have all of the languages that are common to this particular community. So it was a wonderful opportunity to to be able to come to KKV and start this program. And now that the focus is switching over to vaccine clinics, then I'm helping with that as well.
I've noticed we've got a very diverse population in Kalihi Valley. Is there any group or groups of people that may have been missing the vaccinations, and as well as the news about COVID-19, and what have you done to try to address that issue in Kalihi Valley?
Well, Kalihi Valley has a very large population of Micronesian, Filipino individuals, and it's not their language barrier has missed in some of the publications that are out, and even some of the news reports. Because if they don't speak the language or they don't read English well, it may not be easy for them to understand. So part of the outreach that has been very important through KKV and many of the other federally qualified health centers is to go out to the churches and speak to the pastors and the congregations to be able to answer questions in the language that they're comfortable with most and be able to bring them in. And a lot of it is once we get one person in who is in that family and they see that the vaccine worked well for them, they feel better, they can go back to work, all of those kinds of things, then we have the opportunity to bring even more people in. So I begin to see one person that I recognize a family name from, and then 3 or 4 days later at the next clinic, I will see more family members coming in with that same name. And a lot of them are people that I recognize from the contact tracing, many of whom had positive COVID diagnoses back last year.
So it's a two-part. I guess there's a higher positivity rate in some of the races, the Pacific Islander races, Micronesian, Samoan, Hawaiian, as well as Filipino, but you've been able to break the language barrier and now you're getting them vaccinated. Is that correct?
Absolutely. At one point in time when I first joined KKV back in the August-September timeframe, the positivity rate percentage at KKV on any given day for COVID testing ranged from 40 to 60%, and that's a huge number. We had hundreds of people within the community, and this week our case rate of positivity, we had 15 cases.
Great.
So a huge drop. And I think a lot of it has to do with the education and the outreach and the fact that we're getting more and more people vaccinated.
So one final takeaway, we are more than a year into this pandemic. Is there one message that you want to send to the public and to the people in Kalihi?
I would say that vaccinations, come get them.
What a great job that you all have done. Thank you so much.
Oh, absolutely.
Thank you, Teresa.
Oh yeah, it's my pleasure.